On this module, we will be discussing cholecystectomies. A cholecystectomy is the surgical removal of the gallbladder. The gallbladder is a pear-shaped organ located on the upper right-hand quadrant of the abdomen. A cholecystectomy may be necessary if you experience pain from gallstones, gallstones in the gallbladder, gallstones in the bile duct, gallbladder inflammation. As you'll see in this module, a few of our bright, intelligent, and extremely good-looking student nurses will be caring for a patient who has undergone a cholecystectomy.
Hi Lisa, how are you today?
Hi Professor, I'm good. I'm going over my patient's chart before I go in to care for him. He's post-op for a cholecystectomy. He has an incision on the upper right corner of his abdomen, an IV line for fluid replacement, and an indwelling Foley catheter. His current medications are Pepsid, Colace, and Loratab. He's also on a low-fat diet.
Do you have enough of the proper information before seeing your patient?
Yeah, I'm ready to see him.
All right, let's go see your patient.
Hi, Mr. Marcus. My name is Lisa. This is my clinical instructor, Miss Mollet. How are you feeling today?
I'm not doing so good. My stomach really hurts after the surgery.
On a scale of 1 to 10, how would you rate your pain?
At this point, I'd probably say it's a 30. It hurts really badly.
Let's see if we can make you more comfortable.
Will I get any bonus points for that?
I'll be sure to tell the nurse how cooperative you've been. First, can you tell me your name and date of birth?
Zachary Marcus, 10/3/75.
Okay, let's check your vitals. Okay, your temperature is 98.8, your heart rate is 92, respiratory rate is 22 and shallow, blood pressure 128/78, so it's a little over normal limits.
Yeah, his vitals are a little high, and he's in pain. Did you check to see when was the last time he took his medication?
Yeah, he took it about 4 hours ago.
Well, now would be a good time to get him his medications.
Sounds good. We'll be right back with your medications.
I better be getting a lot of brownie points for you keeping me waiting.
Okay, Mr. Marcus, we're back with your medication.
Thank goodness, I can't take this pain anymore.
Okay, Mr. Marcus, before I give you this medication, I need to tell you a little bit of information about your medication. This medication is called Loratab or hydrocodone. It should help relieve your pain. A big side effect is an altered level of consciousness, so you feel a little drowsy and lethargic. You'll also experience respiratory depression, dizziness, and hypotension. There's more information I need to teach you about this medication, but I'll tell you once you're feeling better. Do you understand the information I gave you about this medication?
Yes, pretty much. You mean I'm gonna feel loopy after I take it?
Haha, just a bit.
Lisa, before you give this medication, did you properly check the medication beforehand?
Yes, I calculated the dose and checked the medication route, time, and dose on the MAR. I just need to check to see if it's the right patient, then properly document it after.
Excellent. And make sure that he takes all his medication before you leave the room.
Okay, Mr. Marcus. Can I scan your ID band, please? State your name and date of birth.
Zach Marcus, 10/3/75.
Check the medication one more time on the MAR and see if everything is correct.
Yep, everything's correct.
Great. You're ready to give him this medication.
Okay, Mr. Marcus, do you mind sticking out your tongue? Great.
So Lisa, we'll come back in 30 minutes to check his pain level and do vital signs again to make sure they're within normal limits. Now you can document the time he took the medications and that he understood the side effects of it.
Sounds good. I also need to make sure his side rails are up before I leave to prevent any falls, since he may be feeling drowsy.
What other things do you want to monitor with Lortab?
I want to check his respiration rate. If it's lower than 10, I need to give him an opioid antagonist.
Which is?
Narcan.
Perfect. We'll be back, Mr. Marcus.
Okay, as long as you bring me my bonus points.
Hi, Mr. Marcus. We're back. How are you feeling now?
So much better that I was able to take a nap, and now I feel like a new man.
That's great. How would you rate your pain level now?
I would say it's about a 5. It's tolerable.
I'm glad to see the medication is working. I'm going to check your vital signs again to see if they've changed over the time period.
It's fine by me.
Can you say your name and date of birth?
Zachary Marcus, 10/3/75.
Marcella's putting gloves on. This makes me so
Oh my god.
No! Your temperature is now 98.6, heart rate 76, respiratory rate 14 and unlabored, and blood pressure 118/78. They're within normal limits.
That's really good, right?
It is. Since you're feeling better, I'd like to teach you a few more things about the medication. Before walking, you need to make sure to use your call bell so we can assist you. Also, you cannot drink alcohol while taking Lortab.
Well, damn, there goes my weekend.
I'm also going to check your incision site and Foley catheter right now to see if everything is intact and there are no infections.
Go ahead, I won't bite.
Lisa, do you mind telling me out loud what you are inspecting?
Not at all. For the incision site, I want to check that the incision is still closed, there is no redness or drainage coming out, and it's not infected.
Good. Good.
Looks good.
Now let's check the catheter.
I want to check the amount of urine in the bag to see if I need to change it. Make sure the tube isn't stuck around his leg and there are no loops. I'll also measure the output and document it. I also need to check the catheter for skin integrity. Everything looks good.
And how would you check his urine?
I'll need to aspirate it from the sample port and put it in a container. I can check the color of the urine and send it to the lab to see if there are any white blood cells or blood in it.
Excellent. Now you can take the gloves off and document your findings and your patient teaching.
Alright. Is there anything else you need before we leave?
Yeah, I'd like those bonus points before you leave.
So today, Lisa had a patient who just had a cholecystectomy. His medications are Lortab, Colace, and Pepsid. Lisa already told me about Lortab, so tell me about the other medications.
Well, Colace is a type of laxative. It softens the stools, so it'll help the patient with bowel movements after his surgery.
So what would you want to assess when this patient's taking this medication?
I would assess the abdominal area for distension, auscultate the bowel sounds, and the last time he had a bowel movement. I'd also want to check the stool for color, consistency, and amount.
Very good, Eileen. And what are the side effects you should tell the patient about?
He'll feel some abdominal cramping, but I would tell him it's normal and expected for that to happen. It's also possible that he'll experience diarrhea if he takes it for too long.
So what would you want to teach him?
The major takeaway with laxative is to only use it for short-term therapy. Just how antidiarrheals could cause constipation, laxative can cause diarrhea. The patient would want to use it for a short amount of time to get the therapeutic effect.
Great! Can you tell me about Pepcid?
I don't really know that medication too well.
Pepcid is an H2 antagonist. It helps prevent or heal ulcers in the stomach.
Correct! If you're ever unsure about a medication your patient is taking, always refer to your drug guide.
Of course, it is the most reliable source.
So Lisa, tell me more about Pepcid.
The common side effects are confusion, constipation, abdominal pain, and cramping. You'd want to teach the patient to continue taking the medication even if he's feeling better. Tell him to avoid drinking alcohol and increase fluid and fiber intake to prevent constipation.
Very good. So what would you assess?
I'd do an abdominal assessment on him and check for any pain. I'd also want to check the stool for occult blood.
Very good, you two. Very good. So the patient has an incision line from the surgery, but what would you do if you found the wound opened?
If the wound is reopened, it would be called dehiscence. The first thing I would do is cover it with a wet sterile gauze to keep it moist. I'd also let the care provider know and have the patient move to the emergency room.
Very good. What would you do if you found that a blood clot was blocking their urine from flowing?
If it's ordered by the primary care provider, you should irrigate it with a solution.
If it was an open irrigation, how would you irrigate it?
I'd use the irrigation port and it's still about 30 milliliters of solution and have it drain back into a basin. I'd continue irrigating until the blood clot is removed and the fluid return is clear.
Excellent! Great job, you two! Great job! Bonus points for everybody!
On second.
I'm sorry today.
I also want to check. I would also assess.
Sorry.
I would assess the.
That done did it. You got it.
What are you? What am I?
Let's check your vitals.
No, ID.
Let's not check your vitals.
So graceful. So graceful. Why are you laughing?
You don't have to cut it out.
Get out of here.
So, today, Lisa had a patient who just got a call.